Hello, Ms. Renteria, it's me again. I'm going to show you how I'm going to be doing my IV pushes. First and foremost, I need a doctor's order. I need a doctor's order for this medication. Once I get this doctor's order, I need to check my white site comparability to make sure that I can be diluting certain fluids with my medication. For this example, I am going to be giving 4 milligrams IV push of morphine. My patient's in pain. I assessed his vital signs. I checked for respirations, BP, heart rate, and pain level. He rated an 8 out of 10 pain. So I'm going to go ahead and give him some morphine. So what I'm going to do is I'm going to go into my med room and I'm going to do my 2 checks in the med room with my medication. I am going to be grabbing my supplies. So I am going to be needing my syringe that I will be diluting my morphine with my normal saline. I'm also going to grab 3 flushes to take into the room. And of course have alcohol swabs with me. So I'm going to be giving 4 milligrams of morphine. I could dilute it with 5 mLs of normal saline. I did the math and I'm going to be giving a total of 0.8 ml. So that's going to give me 0.8 mLs of morphine and 5.2 mLs of normal saline. Okay, so now I need to figure out how much am I going to give in 4 minutes, and I'm going to be giving 1.5 ml every minute, which brings it down to 30 seconds. Every 30 seconds I'm going to be giving 0.75 ml, and it's going to be all over in a period of 4 minutes. So with this being said, let's get started. So again, I'm going to do my 2 checks in the med room. I am going to grab my alcohol swab and I am going to do a quick swipe. Quick swipe. Okay, this is trash. So now I'm going to attach my syringe to my 18 gauge needle as such, making sure that it's secured. Okay, now because I'm going to be adding air into my normal saline first, and since I am going to be giving 5.2 mLs of normal saline, I want to apply 5.2 mLs of air. So 5.2. 5.2. Okay. Okay. And since I'm going to be retracting 0.8 mLs of morphine, I'm going to be retracting 0.8 mLs of air.
Right? Can you airdrop it so like they can hear?
Okay.
Yeah. You can airdrop it. You probably can hear last time.
Okay. Now I'm going to be retracting 0.8 mLs of morphine. Okay, and it's hard because they've been so used, it's kind of hard to, I'm getting some tension, so.
Is it? Okay, so I can airdrop it to you if I film it. We declined it. Oh, I know, I declined it.
Okay, so while I'm here, I want to make sure that I could unattach this and make sure that all my bubbles are up. Get my bubbles. Okay, now I could go ahead and insert my needle into my normal saline and retract all the way to 6 mLs because that's what my total amount of fluid is. Making sure that I get right at 6. So I'm at 6, could go ahead and remove this and make sure that all bubbles are out. But there's water all over it. So it would be 6 mLs. So now what I'm going to do is make sure safety first. So make sure that my syringe is capped. From here, I will label my syringe. I will label what the medication is, how much of it is. So in this case is 4 milligrams per 6 mLs. And I will initial my name, the date, just to make sure that it's me, the one that prepared the medication. From here, I would grab my medication. I will take it to the room, to the patient, and I will take my 3 flushes along with my alcohol swabs. Once I enter the room, knock, 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 hand hygiene, I will identify my name, my patient with 2 names, with 2 identifiers, and I will assess for allergies. I will assess for pain again, because this, I need to know that the appropriate medication is given for the proper pain scale. So from here, what I would do is, if I were to have a pump running, I would pause the pump, or if it's saline locked, then I'm okay, making sure that this is unlocked. So now I would apply my gloves. Oops. And I forgot to mention, I would, alongside with my 6 mLs of medication, I would also have the same amount of normal saline, because I'm going to flush with that after the administration. So what I'm going to start by doing is I'm going to assess the site. And by doing so, I'm going to be scrubbing the hub for 15 seconds. While I'm scrubbing, I am looking for any prurita, any redness, inflammation, any drainage, anything that looks abnormal that might be a signal me to put a new IV. Okay, 15 seconds have gone up. And from here, I would grab one of my flushes, uncap, attach. And what I want to do here is I want to look for flash. Okay, I see flash. Okay, that's what I'm looking for. After that, I want to unattach my flush, discard of it appropriately. Get another alcohol swab. Scrub the hub for 15 seconds. Apply friction to the top of the hub. Okay. Okay. And from here, I want to grab my other saline flush, and I'm going to attach. And I am going to be administering 3 mLs of saline flush, of normal saline, just to make sure that IV site is patent. So while I'm doing this, you know, Mr. Smith, how you feeling? Do you feel any pain while I flush? Okay, no, there's no pain, there's no infiltration, redness, inflammation. So 3 mLs have been inserted. So I can go ahead and unattach the saline and discard of it appropriately. So from here again, I will grab another alcohol swab and scrub for 15 seconds. I could use this time also to again check the patency of the IV site. Okay. Once the 15 seconds are up, I could go ahead and throw this away. With this, I can remove it, discard of it appropriately in the sharps container, and this would have 6 mLs. Because of the discussion, I wasn't able to put it out, but it would have 6 mLs. and I would attach my medication. And we agreed that we came up that every 30 seconds we're going to be giving 0.75 mLs per minute. I'm sorry, 0.75 mLs per 30 seconds. So I am going to be doing this slowly enough, 0.75, where I do my medication for 4 minutes.
Explain the procedure to him and let him know that I'm gonna do it. So I would do
So for instruction purposes only, I would make sure that I push the medication nice and slow, very flowy, for 4 minutes. For 4 minutes, while I'm pushing slowly my medication, I want to be assessing my patient, making sure that he or she is not having any adverse effect, any reaction that we don't want. Assessing the patient, how they're feeling, assessing their psychosocial status, or anything we need to assess, any concerns. Okay, so we would be done. We would discard of our medication. We would grab another alcohol pad. We would scrub again for 15 seconds. Okay, and then we would grab again our normal saline flush that has 6 ml, because we want it to be equivalent as our medication dosage. Okay, and again, this process would also require us to do this to push this medication for over 4 minutes, every 30 seconds, 0.75 mLs. So we would do it slow enough where we are following this standard. And again, keep assessing the patient, keep talking to the patient, assessing any concerns, questions they might have, or anything that we need to speak about. So again, for educational purposes only, so we would have been done with pushing with 4 mLs of the medication that's diluted with normal saline would be done. We would have discarded this, and then we would attach the green port, the green sterile port, to make sure that no bacteria gets inside of our clean port. So from here, I would clamp the IV site, and then I will say, Mr. Smith, we are done with your medications. If you have any questions, you need to reach me, please go ahead and press the red button outside of your bed or in your remote control, and I'll be here as soon as possible, okay? Then from there, I would document, sign, because I don't want to sign in the computer if I have not administered the medication yet. I would document how my patient took the procedure, the patency of the IV site, how much I gave, and how long I gave it for. And that's